Hello, hello. We are live. I'm Dr. Frita, and welcome to another Medical Monday, where we're talking about medicine in the news. I give you the hottest health topics in the headlines, and I explain them in an evidence-based way. Today, we have a lot to talk about. So come on in here. Please click that like button and invite others. Share this because we're talking about Kate. Princess Kate, Princess of Wales, and how she revealed that she has a diagnosis of cancer after a major abdominal surgery. And so we'll talk about the different cancer screenings and the possibilities of abdominal cancers so that you and your loved ones can be sure that you're up to date on your cancer screenings, and we try to be preventive. And then we'll talk about the bubonic plague. Did you know that that's a real thing? Yeah, it is. It's caused by a bacteria, and we actually had someone to die just recently from the bubonic plague. So I'll touch briefly on some of the signs and symptoms and how you get that. We're also going to talk about an over-the-counter birth control pill. Yes, you don't need your doctors anymore. You can go to your local CVS, to Walgreens, you name it, and you can just get your own birth control pill. Well, birth control pills are a medication, so we'll talk about the pros and cons and what this means as far as women's health. And did any of y'all watch Real Housewives of Potomac? Yeah, there was a big fight, a bar brawl, if you will, among the ladies. And so we'll talk about some of the dangers of a bar brawl. And then we'll talk about a juicy topic, Mia and her husband, Gordon, also known as Daddy G, and what may have played a part in their breakup. We'll talk about the prostate cancer surgery he had and how it led to him having erectile dysfunction and allowing her to be with other men. Oh, yeah. He signed off on an open marriage. So we'll talk about that, prostate cancer, screenings, surgeries, and some of the indications. You know, we're going to talk about so much more. I'm going to take your questions live. We might talk about Oprah, okay, shame, blame, weight loss revolutions. This is what I just want you to do. Stay with me because I guarantee we'll have an entertaining and educational show. So come on back. All right, let's get into it. I am Dr. Frita. I'm a medical doctor who has been multi-board certified, and let's get into this medicine in the news. I'd like to invite up my co-host, Shador. Where are you, Shador? Shador is my practice manager. Hey, Shador, how you doing?
Hey, Dr. Frita, how are you doing today?
Hey, doing great, doing great. Shador is my practice manager. She manages my nephrology or my kidney practice, Midtown Atlanta Nephrology PC, and she'll be helping me as we talk about some of these topics and get through the headlines. Let's start off with the bubonic plague. Shador, I mean, people talk about the bubonic plague, it's biblical, but I don't think anyone really understands that it is a real disease, that it really exists. We're going to get into that, but actually, before we do any of those things, I want to touch on a comment that I received on one of my YouTube videos. I want to know if you'll put that one up and let me go ahead and respond to that.
All right. So this is from Jar PT Chow 85. This lady does not have a sign on her YouTube that she is actually a medical doctor in the USA. So do not believe in anything she says.
Oh my gosh. All right, Jar PT Chow. Can y'all believe she said that to me, that I don't have a sign that I'm an American doctor, a doctor from the US, and you shouldn't believe what I say? Well, Jar PT Chow, I want to make sure I respond to you directly. So I am an MD. I'm a medical doctor. I've done all of my certifications in the United States. I'm not even a foreign medical grad. I was born here, raised here, all of my schooling done right here. And I'm going to go ahead and give you some of my credentials. It's easy to Google me, okay? It's easy to find out because I have a very strong footprint. But I have to say, Shador, I'm curious, what is it about me that will make Jar PT Chow assume and say so emphatically that I am not a doctor in the United States? I wonder, I mean, does she say that to everyone? Like, I wonder if she goes to all of the male doctors and says it to them. I'm not sure. I wonder, I don't know if I looked a little different. I'm trying to think. It can't be the evidence because all of my videos are evidence-based. I go by scientific trials. And if you compare what I say in my videos to any other reputable source, be it, Harvard Medicine, Cleveland Clinic, Mayo Clinic, you choose, then you'll find that my information is evidence-based. So it couldn't have been a lack of evidence in my videos that made her make an assumption about me. And then I was like, well, do I speak with an accent? I mean, I am from the South, and I know I slip into a little urban vernacular here and then, but quite honestly, when I am speaking in my videos, I make sure that I have proper subject-verb agreement. I use my adverbs properly. I don't leave dangling prepositions. I'm quite good with my grammar. So it's not going to be the way that I speak that makes her assume that I'm properly credentialed. So it's not the evidence, it's not the knowledge, it's not the way that I speak. And so I guess only Jar PT Chow would know what it is about me that made you feel so bold as to say that you don't think I meet the credentials. And then you have told everyone, all 703,000 of my subscribers, not to listen. Well, let me go ahead. For anyone who is curious about my credentials, I'll go ahead and lay them out for you. And again, it's very easy to find out about me, but I'll take it all the way back. I grew up in St. Petersburg, Florida. I went to the International Baccalaureate program at St. P. High. When I graduated, I obtained my IB diploma, which meant that I went into college already as a sophomore. I went in with 30 hours, and my college was Florida State. I was in the honors program at Florida State University, graduated from the honors program, Florida State, that's also in the United States, Jar PT Chow. And then from there, I went to Meharry Medical College, which is an HBCU. It's one of the historically Black colleges and universities, where I graduated from medical school with an A+ average. And listen, Jar PT Chow, I was inducted into the Alpha Omega Alpha Honor Medical Society, which is the highest honor attainable by a medical student. On and on and on. I did a double residency, 1-2, microphone check, 1-2, 1-2, double residency, internal medicine and pediatrics at Georgetown University Hospital. Afterwards, I received my board certification in pediatrics. I received my board certification in internal medicine, all in the United States, these United States of America. After that, I came on to Atlanta, where I am now, and I completed my fellowship at Emory. You've heard of Emory, at Emory University School of Medicine. After that, I got my board certification in nephrology, which is the study of kidneys and high blood pressure. I hope that's enough for you, Jar PT Chow. Oh, in case it's not, just now, this year, 2024, in January, I received my board certification in obesity medicine from the American Board of Obesity, from the American Board of Obesity Medicine. So Jar PT Chow, I certainly thank you for bringing your concerns and give me a chance to share with anyone who may have been wondering. I am very highly credentialed in these United States of America. I hope you continue to enjoy my videos. All right. Now let's get into these topics. Ooh, Jar PT Chow. Let's get into these topics. The bubonic plague. Okay, so someone has died in New Mexico from bubonic plague. It's a real thing. It's actually a bacterium, okay, Yersinia pestis, and it's usually in rodents, okay? The rodents will get it after being flea bitten. Yeah, this bacteria will be in fleas, and when they bite the rodents, like the rats, mice, that's their host of choice, then they'll end up getting the bubonic plague. And for humans who deal with perhaps animals who have the bubonic plague, maybe it's a carcass, maybe it's a dead animal, maybe it's your own animal, like a cat. Someone in Oregon, not too long ago, also got the bubonic plague from his cat. And yes, the bubonic plague can also infect cats, so cats and rodents mainly. But here's how you know if you have it, and I hope you don't get it. But 2 to 7 days after being exposed to the bubonic plague, you will likely get a high fever, chills, malaise, feel very, very sick, and then you get a swollen lymph node, okay? Like the lymph nodes, these little collections, part of your lymphatic system. I went into details about what lymph nodes are when I did that Wendy Williams series. Where is Wendy Williams? What happened to Wendy's feet? Lymphedema? Well, that's a part of the lymphatic system. And so in your lymph nodes, which are part of the lymphatic system, if you get exposed to bubonic plague, you'll get swollen, usually painful lymph nodes. They can be in the groin. They can be in the underarm, your axilla. They can be like around your neck. And oftentimes they can actually erupt or erode, okay? And you can get hyperpigmentation or darkness, dark spots in the skin. And here's the real kicker. If it's not treated, the plague can be very fatal. Okay. Some strains you will die. You have a 40 to 60% chance of dying if you're not treated at all. Like, unfortunately, this young man died. We do have treatments. We have antibiotics like streptomycin, even ciprofloxacin, aminoglycosides can treat it. But the key is to really try to get treated within 12 hours of symptoms. So that was just kind of a random headline, Shador, because, you know, in all your years of working with me over a decade, we've never had anyone with bubonic plague, but it's here. Some of these things are popping up. There is a vaccine for it, but it's not recommended that you get the vaccine unless you're someplace where you're at very, very high risk. I know some places like Peru, the Democratic of Congo, some of these places are at higher risk than others, but just, you know, knowledge is power. And so the bubonic plague is out there, Shador. Yeah.
Yeah, it is. It was very surprising to me. You heard my reaction when you spoke on it. I was,
Yeah. Yep. All right. Shador, who was the first one in here today in this chat today?
Yes. So the first person here today was Miss Krista Arnfield.
Yay. Thank you for being here, Miss Krista. All right. Y'all, please be sure as you come in, like this video, this live as you come in, share it with other people, and we'll keep on giving medication. So let's move on to the next topic. Okay. Birth control pills. Now, we know, Shador, that birth control pills are medications, right? Medications that normally require a prescription. And luckily, with a lot of health plans, like the Affordable Health Care Act, for example, and a lot of other plans, the birth control pills will be afforded for free to the patient, or, you know, with the insurance. Well, now, birth control pills, a certain one, is over the counter. What do you think about that, Shador? You don't even need to talk to a doctor. You can just pop up and get it. We have a video on that.
Yeah, we do have a video on it.
All right, let's take a look.
At least, I guess. Well, here we go.
All right.
And we knew this was coming, but now you can add birth control to your Amazon cart. Opill is officially available online without a prescription. Many health officials see this as a major step toward expanding access to this medication, with the American Academy of Pediatrics applauding this decision. One pack will cost $19.99, a 3-month supply $49.99, or $89.99 for 6 months. Opill has been on the market for decades, and recently the FDA approved it for over-the-counter use because the agency has confidence that Americans know how to use this product safely. Experts urge anyone planning to purchase Opill online to carefully read the label, which clearly states that anyone who has had or currently has breast cancer should not take it, and patients with a history of any cancer should consult with their doctor. It is meant to be taken at the same time every single day. Doctors say, similar to other birth control pills, the side effects of Opill can include bleeding, headaches, dizziness, nausea, cramps, increased appetite, and bloating. Bottom line, though, the FDA says Opill, when used properly, is safe and effective. But if you have any questions, of course, talk to your physician. Robin.
Okay, everyone in the chat, I want to see your votes. Put a 1 if you think that having over-the-counter pills that you can just get off Amazon, order them off your Amazon Prime. If you think it's a good idea, press 1. If you think it's a bad idea to have this medication just now available to whomever, all willy-nilly, then press 2. If it's a good idea for it to be over the counter, press 1. Bad idea, press 2. And if you have a comment as to, you know, why you have your opinion, then please let us know and we'll talk about that. Okay. But first, let me talk a little about this Opill, Shador. So here's what it is. So yes, it is a birth control pill to be taken every day, once a day, the same time each day. And if used in that manner, taken consistently, is 98% effective as far as preventing pregnancy, right? So this is really neat. This is a way for women to be able to take control of their bodies, right? And to be able to prevent pregnancy if it's their choice. Okay, so there you have it. That's a positive. But it is a medication, right? And we know that with some birth control pills, there can be side effects, which when you go to your physician, like your OBGYN, or to your primary care doctor, your internist, your family doctor, there's a very careful choice made as to which birth control pill you're on. So that's one thing that could give some people pause. It gave me pause at first, but here's the thing. With this Opill, unlike some of the other birth control pills, which have both estrogen and progestin in them, the Opill only has progestin. Shador, let me tell you why that's important. When you have pills that have the estrogen, those are the ones that can put women at a higher risk for blood clots and for high blood pressure. Okay, so when you're dealing with the combined pills with the estrogen in them and the progestin, women, especially if they're over the age of 35, and if they're cigarette smokers, they can be at high risk for blood clots. And we know that blood clots can break off, go to the lungs, and can be fatal. Okay, blood clots. In fact, if you look right here on my YouTube channel, you'll see, oh my gosh, it's been a while where I talked about blood clots or deep vein thrombosis. And that was a minute ago. That was back when Nene Leakes from Real Housewives of Atlanta had talked about having a blood clot, and even Kim Zolciak had experienced a blood clot. So that's something to check out because blood clots can be fatal. So yes, the estrogen progesterone combination pills can put you at higher risk for those things. But with the progestin only pills, that's what this over-the-counter one is. The progestin only pills don't carry those high risks. You don't have that higher risk to that degree of blood clot. So most people do well, except as mentioned in the clip, if you have cancer, specifically breast cancer, liver cancer. So if you have any history of cancer, of malignancy, you definitely want to consult with your physician because the over-the-counter pill is not right for you. So I guess the only thing that really kind of makes me have a little pause is, what if you're someone, say you're going over the counter, Shador, because you don't have health insurance? So what if you haven't gotten your cancer screenings? What if you don't know, right? If you have cancer, cervical cancer, breast cancer, because you don't have health insurance, so you can't afford to go, yet you can go down to the Amazon, go to your Amazon lockbox and pick up the pill. That is something that's very curious. However, apparently the FDA feels like the benefits of giving women access to these pills outweighs the risks. But I'm curious to know, Shador, has anyone commented? Do we have any ones, or people think it's a good idea to have it over the counter? Or do we have any twos, or people are like, child, please keep this thing where it is, where doctors have to prescribe?
Yeah, so the majority is number 2. Miss Anita Gibson.
Oh, what do you say, Miss Anita?
Not a good idea. Need a pill design closer to health needs.
Okay. And anyone else give their reasonings? Okay, so she thinks
it's right.
Hello, how are you doing? Thanks for the comment. Now, what are you saying here?
This says not to mention abuse of the medication. Does not agree.
Okay, all right.
Miss Anita Johnson. It may not agree with everyone.
Interesting. Okay, so a lot of you are thinking it's still a medication. So it should be regulated by a doctor. But for all of my twos, everyone who's commented, what do you say to these young women who don't have health care and they can't get the pill, and then they don't want to end up not only not having health care for themselves, but now inviting a whole new baby into the earth that perhaps they can't afford or perhaps they're not ready for? Because these will be available not only to young women, but even teenagers can use them. You think they still need to kind of figure it out, go get a healthcare plan? Okay. Is anyone forward? Anyone comment or say, do we have any ones?
Yes, we have 1-1, Miss Ashika Wade.
Hey there, Miss Ashika Wade. Okay. She says, let me have my autonomy, my independence. Let me go on and get my pill. All right. All right. Well, apparently everyone else in the big government and in FDA agrees with you. They all are for the one, because as it stands right now, you can hop right on your Amazon app today and you can order yourself a birth control pill. For a 1-month supply is $19.99. For a 3-month supply is $49.99. Now, there is an organization called Free the Pill. Like, y'all remember Free Willy, that movie with the whales? But Free the Pill, where they want it to be much less expensive. They're trying to get it to where it's $15 for a 3-month supply. Because if you are pinching pennies, if you're trying to pinch a penny till it pops and you have like fixed income, then $20 a month can be expensive. And so there are organizations. Also the company that's making the O pill says that it will have an organization where if you are of low income, or if you're underinsured, or if you're having an issue with getting the pill, they say they will have a program to make it easier for you to get the pill. So you might not have to pay that $19.99 after all. But that's interesting. That's something major. That's something I really...
of money. So Blunt had a comment in regards to that.
So Blunt, not So Blunt.
They voted number 2. It says it's taken away with Planned Parenthood was established for. Safety is key. This appears to be a monetary situation.
Ooh, that's interesting. You're right, because we did have a lot of programs where you could get the birth control for free. And even now, a lot of the insurance programs, Affordable Health Care Act, will give the birth control for free. So this is something that's new. It's new. It just got approved in July 2023, and it's just now, where it's really out there on the market. And so I will, stay on top of these things and really see, which way it goes, if it's going to be a pro or if it's going to be a con. We shall see.
Here's the alternative, Miss Arnita Johnson. Abstain if not married, have husband vasectomy.
Oh, abstain if you're not married. And if you have a husband and you don't want to get pregnant, have your husband to get a vasectomy. Okay. Oh, let me ask you a question. Now, have you been down to the Instagram, YouTube, to these middle schoolers, to people out in the streets? It's spring break. I don't know if a lot of them are abstaining, but there you go. Definitely, if you abstain, that is the most guaranteed way to not get pregnant. But the way things are, and I mentioned at the beginning of the show that I got board certified in pediatrics. That meant I did a lot of adolescent medicine, talking to teenagers. And actually, I was at Georgetown, which is a Catholic school, where they definitely preached abstinence. But when I talked to those girls one-on-one, my nice little Catholic school girls who would come to see me in the adolescent van, or to come to see me in my adolescent practice, I'm just going to tell you the truth. A lot of them were not abstaining. And so while that's definitely one of the things for us to teach as, a way to not get pregnant, we still, I believe, have to be ready for the other ways that are coming down the pipe. So we'll see how this pans out. Thank y'all for your participation. Oh, I like it when things are interactive. All right. Please make sure that as you pop in here, you go ahead and like this video. Make sure you subscribe to my channel, because we still have more topics coming up. We're going to talk about the Real Housewives of Potomac. Oh, which the comment we just got about getting vasectomy, that's going to lead me into that as well. And we're going to talk a little bit about Oprah Winfrey and her shame, blame, weight loss revolution, where she used to be with Weight Watchers. Now she shares that she's been doing weight loss medications. We'll touch on that a little bit. And definitely we are going to talk about the Princess of Wales, the wife, the mother, our princess, well, their princess, but a mom, someone we can all definitely relate to on a human level. She shared that she has been diagnosed with cancer. She has not shared just yet, and she may never share her specific diagnosis. But as always, when we're talking about medicine in the news, I like to take what's going on in the headlines and relate it to individuals in real life, so that we can live our healthiest, happiest lives and use it as a vessel to do all the screenings we need to do. So we'll definitely talk about that. All right, Real Housewives of Potomac. I want y'all to give me a 3 in this chat if you've ever watched the show, or if you know what I'm talking about. The Bravo show, Real Housewives of Potomac, in that DC area. Give me a 3. And I know y'all sit up here, y'all listen to a lot of educational programming, and I know a lot of y'all watch my videos, and so you care about your health, and you're pretty highbrow. But I know I'm not the only one who does reality TV. Give me a 3 if you've ever watched the show or if you've heard of it, Real Housewives of Potomac. Because we had the comment on abstinence and having men get a vasectomy. But on Real Housewives of Potomac, one of the new cast members, we have Dr. Alicia and then her husband, Dr. Kima, and they're into dentistry. He's an oral surgeon. He is from, I believe it's Nigeria that he's from. And he says on the show that he does not believe in men getting vasectomies. He said it's like them cutting their off, is what he says. So you do have some men, I don't know if it's all cultural or if that's just him, who oppose getting vasectomies. But quite honestly, especially if you, as was mentioned in our comment, if you're someone who's married, or if you're someone who is quite sure you're a man, you don't want any more children, or you and your wife don't want any more children, instead of the wife being on birth control pills, instead of the wife getting her tubes tied, which is, it's a surgery, right? It's an abdominal surgery. Instead of the wife having to get a hysterectomy and do all these procedures, which are more invasive, it is less invasive for the men to have a vasectomy, where the tubing is tied off so that their sperm and their ability to have a baby, where that's cut off. It's really actually a less invasive procedure, much simpler. So that's a good point. Men can get vasectomies. If there are any men in the chat, ooh, y'all don't have to answer. Ooh, but I want you to. Any men in the chat, I want you to press 4 if you would never, ever, ever get a vasectomy. Now, if I see any 4s, I'm about to jump through this computer screen. 4 if you wouldn't do it. If you agree with that doctor from the Real Housewives of Potomac, that's like cutting your man head off, getting a vasectomy. Anyway, but we can move on. But there's something else I do want to talk about, Shador, with these Real Housewives of Potomac. I watched it last night. Do you ever watch that, Shador?
I do not watch one series, Atlanta, New York, none of them.
You don't watch them? Well, you probably have much more peace, a peaceful life for it. But let me tell you, that's one of my vices. I do watch the reality shows. I do. I'm sorry. But what I will do and what I won't apologize for is that anytime I see that there is a health topic that's there, then I do like to bring it to the forefront and we can talk about the health topics that come up. So, Real Housewives of Potomac. They had a bar brawl, Shador. Literally, they were there was an event that was done for Giselle and Ashley's line. They have something called G&A, which I think is kind of cute. Giselle and Ashley, where they have like this athletic wear, okay? And it kind of looks like you can wear it to the club, okay? Or you can skin to win, but it's supposed to be for exercising, like this leisure wear. Anyway, they had an event. And then afterwards, oh my gosh, some of the ladies got into it, okay? There's one lady named Deborah who was there. And so she apparently physically was kind of going after one of the cast members, Candace, really beautiful little petite person. She's petite, but she does not have a petite mouth. Candace can read. She can tell you off. At any rate, what happened, I guess I'll say allegedly, even though the audio is out there, the tapes are out there. Apparently, this Deborah person threw a drink on Candace. Candace grabbed a bottle, but fortunately, someone stopped her before, just in case her emotions were going to get out of control. And then there was someone else, Kiana, I believe is her name, who kind of tried to intercede and get in the way of Deborah. Child, Deborah took a glass and hit Kiana in her face, drawing blood to the point where she had to go to the ER. Okay. And these are refined ladies of Potomac in a straight up bar brawl. So what I do want to say is this, because, I think that on a lot of times on these reality shows, you have, producers, they kind of set the scene. Sometimes they will have people who don't get along come into a scene just to create that drama. But y'all know it's so important not to let the drama get physical, because here are some of the things that could happen, Shador, if you get hit in the face with the glass, right? So if the glass breaks or fractures, which apparently it did since it drew blood, then of course you can have a disfiguring scar on your face. That glass could have hit her in the eye, right? It could have ripped her cornea. It could have caused blindness, right? Bleeding in the eye. It could cause infection. Okay. If someone had been, sitting there sipping their champagne and maybe they had some type of, we all have bacteria in our mouths. If that got into your skin, you could have infection. But then what if she had hit this lady in the side of her head? Okay. She could have caused a bleed of a major artery. She could have given her an epidural hematoma, which could lead to death. And so oftentimes if people get hit in the side of the head, right kind of near the temporal region, Shador, they can get a bleeding and they can kind of lose consciousness, but then they come back. Okay. And once they come back and they're awake, people think, oh, good, they're doing fine. They're fine. But then that bleed continues. They lose consciousness again, and they can continue to lose consciousness and never wake up. Something as simple as a bar fight over some foolishness could cause death in that regard, and there are many other things that could happen, of course, when you're in a bar fight and say you punch someone in the mouth. Why these refined ladies, the Real Housewives of Potomac, would be punching, I don't know. But hey, if you're going to be, busting people in the head with glass, you might do those things too. But say you punch someone in the mouth and you get a cut with a human bite. The human mouth is quite frankly filthy, full of bacteria, and you could get an infection in your hands. You can get infection that affects the tendons where you need surgery, or you can even get yourself to the point where you could need an amputation. So you can have a very serious injury with a human bite full of bacteria. And that's something that could happen if you're having a bar brawl. So that's one of the things from the Real Housewives of Potomac. Okay. So did anyone admit with a 3 in the chat to either watching it or knowing of the Real Housewives of Potomac?
Yes, so Miss Anita Gibson.
Ooh, Miss Anita.
Miss Phillips Wright says drama. And she would not use the word refined. She's a damn trick.
Okay, I'm being generous. Although that doesn't represent all of the ladies on that show. That Deborah, she's not even a cast member sitting up in there. Okay, who else watches this show? Come on out of the closet, y'all. I said I'll watch it. Just come on out. Come on out the closet. Yeah. So that's what happened with that drama. But there is more drama that does relate to medicine. It's medicine in the news, Shador. Y'all know Mia? Yes, I know the ones of you who watched it. You know Mia. Okay. So Mia is one of the wives, and her husband is something like 30 years older than she. I think she's reported to be about 38, and her husband is 71. And he found her in the strip club. She said that she didn't really strip. She said she more just, helped to, serve food, and they serve shrimp and lobster, but I don't know about that. So he met her in the strip club. And he was married. I mean, they shared this, that they were married, that he was married when they got together, and she was actually in a relationship. But he bought her a car, he set her up, he proposed to her, and there you have it. He has this young lady who's about 30 years younger than he. Well, guess what? He unfortunately developed prostate cancer. Gordon did, her husband. She calls him Daddy G. So that's how it relates. Okay, the Real Housewives of Potomac. Gordon developed prostate cancer, which we know prostate cancer is more, it happens to Black men at earlier ages, and it tends to be more aggressive in Black men. We know that Dr. Martin Luther King Jr.'s son, unfortunately passed away recently, right? The youngest son, Dexter, died with prostate cancer. We also know that we had General Austin, Secretary Austin, who had an issue with prostate cancer. He went in for surgery. That had all kinds of drama because apparently he didn't let the administration know. He didn't let the White House know. Then he had complications of prostate surgery, right? Another Black man. It's just very, very common. And so if you're listening to the sound of my voice, make sure you talk to your family members and find out who in the family has had prostate cancer, because it's very important for men to get screened. The screenings are not black and white, okay? They're not black and white. So it's important that you have a conversation with your physician no later than the age of 40, but earlier than that if you have a family history of prostate cancer, especially in a first-degree relative. When I say first-degree relative, I mean in a father, in a brother, in someone who's close to you. If they have prostate cancer, talk to your doctor pretty early about the possibility of getting screened, even in your 30s. So there are tests, Shador. There's a PSA, prostate specific antigen. I know in our office, you've seen me look at the PSAs on our men. If that PSA is less than 4.0, okay, then it's considered technically normal. However, you also want to watch the trend, okay? If it's something that has increased, if it's over 2.5, then that could change the frequency of the screening. So the prostate, if the PSA is elevated, that could mean that you have prostate cancer, men, or it could mean that something else is going on. The prostate could be inflamed. You could have prostatitis. Okay, there are other reasons. That's why it's important to talk to your physician. Yes, you can talk to your general, your primary care physician, your internist, your family doctor, and also your urologist. Okay, your urologist. That's going to be the doctor who specializes in prostate procedures, and not just prostate procedures. They specialize in kidney procedures, bladder, ureter, all of those things. For men who have erectile dysfunction, no shame. Okay, live long enough. A lot of men will get it, but the urologist is the one you see for that. Which leads me into the next part, and this is where it gets juicy, Shador. So I mentioned that Daddy G, Gordon, Mia's husband, who's about 30 years older than she, he had the prostate cancer surgery. And then he shared on reality TV for the whole world to see. But I'm kind of glad because he's not the only man, especially a man of a certain age, going through this. He explained that he was not able to fulfill his wife sexually the way she wanted to be fulfilled after the prostate cancer surgery. And that's important. Now, when you talk to your urologist, you want to ask the question, men, if you have prostate cancer, ask them which procedures will give you the lowest amount of risk for having erectile dysfunction or having problems with your love life. Because now we have robotic surgeries. Sometimes you don't even have to have a total prostatectomy. You don't have to have the whole prostate removed. You might need to just get radiation seeds. There are other things that are not necessarily very invasive. And if the prostate cancer is picked up early, then you may be able to have a procedure that's not as invasive. But that's why it's important to get screened, have this conversation no later than the age of 40 with your doctors, so you don't end up in a space where you have to necessarily do extreme things or you don't have much of a choice. But even still, a lot of times, not all the time, but sometimes the men will get the erectile dysfunction. So here's the tea. Because he developed erectile dysfunction, Gordon, after his surgery, he told his young wife that she could go and be with other men to fulfill her needs. Yes, he did. He said it out of his mouth last night on the finale. He told her that she can go be with other men, but then he said that he had rules. What rules? He said that she could do it, but she couldn't have the kids around them. She couldn't sneak around. She had to let him know what she was doing. How do y'all think that worked out? It didn't, because what Mia did was she went back to her first love, okay? Someone she was with since she was like 17 years old. Actually, the man she was with at the time that Daddy G, Gordon, took her away. And so now she's not just getting her needs fulfilled. She's in love with that man. So that's the drama. But the medicine of it is that you want to make sure that for men that you get your prostate cancer screenings, that you have the conversation. And yes, there are digital rectal exams. Yeah, when I was training, we did those where your doctor gets a gloved hands and puts the digit in the rectum because you're able to feel the prostate for any lumps or bumps there. But we have other ways also, which are actually more effective than the digital rectal exam. They have MRIs. Yeah, prostate MRIs. So have the conversation. Don't let your toxic masculinity keep you from getting screened to the point where you sit up here and you end up with prostate cancer. Okay, so that's the Real Housewives of Potomac Medical issue. There was another one, and it's actually very sad. Giselle's dad.
Dr. Frita,
What's
you
that?
did have some comments about the prostate cancer from some of our viewers.
Oh, let me hear. Yes.
Yes, ma'am. So Miss Monica Hill, she says, my husband recently finished his radiation treatments for prostate.
Very good. Thank you for sharing, Ms. Monica Hill. So I'm glad that he's getting his treatment. And, you know, and you want to make sure that he keeps an open and honest conversation with his urologist, because not trying to put anybody's business on Front Street, but if there are any issues, we have all kinds of tricks and gimmicks and procedures to make sure that everyone is fulfilled as they want to be fulfilled, you know, as far as different issues that can come up like erectile dysfunction. But I pray your husband does well. Thank you for sharing, Miss Monica.
All right, Miss Arnita Johnson.
Hi, Miss Arnita.
She said, my brother had it. He had surgery this year, a few side effects, but hopefully nothing else. He is 55.
Yeah. Well, 55. See, that's not very old, is it? 55. So that's what we talk about, having that conversation no later than the age of 40. But I pray your brother does well. I pray that he does well and that he talks to his urologist, you know, for everything he might need.
Yeah. Miss Rosalie Pontside.
Hi, Miss Rosalie.
She says, my stepdad had it, the most horrible cancer, super painful. It was so hard to see.
Oh, I'm sorry to hear that. I hope he did well. Yeah, it's so tough when we're talking about these cancers, right? Because for some of them, we do have screenings, but for some of them, we don't. For some of them, we really don't. So as you come in, you know, thank you for everyone who's here. Make sure that as soon as you come in, you go ahead and hit that like button and please subscribe on this Dr. Frita channel. We're up to over 700,000 subscribers. I'm very proud of that. So come on in, subscribe, and let's see. We can move on to another topic. Now, I did mention when I was talking about that O pill, that for the O pill, it was progestin only, right? But for the traditional, some of the traditional birth control pills, they have the estrogen and they have the progestin, and that can increase your risk for hypertension, or if you already have hypertension, it can worsen your hypertension. Well, let me tell you, I want you to make sure that you check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. Because if you are one of these people and say you're on one of the prescription birth control meds and you have high blood pressure, there are ways beyond just medicine that you can actually maintain a good blood pressure. So in addition to getting the O pill on Amazon, you can also get my book, Under Pressure, A Guide to Controlling High Blood Pressure, on Amazon. And we'll make sure we have that link in the description. Okay, so let's see. We talked about a few things so far. What did we talk about? We talked about bubonic plague. We talked about the O pill. We talked about Real Housewives of Potomac. And yes, what I was saying is that one of the stars, Giselle Bryant, her father sadly passed away from brain cancer. That's one of those ones that we actually don't have screening for. And we know we've had some major I'm so sorry to hear about that. Her dad's he's a neat looking guy, but he also was just a real cool dad. You could tell she was very close to him. Now, a lot of people have problems with Giselle because she could be shady to the nth degree and act up. But I will tell you, I will give her this. She really seemed to be a good daughter. Okay. She loves those parents. and a good mother. So I'm going to leave her alone, and I pray for healing for her family, because even though it looks like he passed away a little while ago, now that the show came on and they talked about it again, I bet that, opens up wounds. But, for that brain cancer, I'm not sure of the kind that he had, but we know that President Biden's son, Beau Biden, died with brain cancer. We know that we had our Senator Ted Kennedy, who had the brain cancer. And we talked about a different type of a cancer. This one is more common in pediatrics, one that Michael Strahan's daughter is living with. And she got the diagnosis when, I think, right before her 19th birthday. And she talked about the surgery that she had with the meningoblastoma. If you go to my IG channel, my Instagram at dr.frita, you can skim through where I have different videos on these different topics. I talked about her brain cancer, Michael Strahan's daughter, and the signs, the symptoms, the treatment, things of that nature. And I also have videos on prostate cancer. If you go through my IG, I talked about, when we lost Dexter King, Dr. Martin Luther King Jr.'s son. I talked about some of the strategies for making sure you have the conversations with your physician about that. There's just a wealth of information. So make sure you also follow me over there. And right here on this YouTube channel, I definitely have a prostate cancer video where I go into detail, about the signs, the symptoms, the screening, where I give you a lot of information about that. In fact, there's a playlist. I have a cancer awareness playlist where you can go through. Okay. So that is something that we can do. And let's see, Shadora, do we have any other comments before I move to the next topic, or even some of the comments that we picked up on some of my videos? If you see any of those.
If I may, can I touch on a couple more comments regarding the prostate? I think some pretty important, interesting ones, to say the least. So Optimal Living asks, can you list some symptoms of advanced prostate cancer, please?
Yes. Now, of course, the goal is for us to catch the prostate cancer before it becomes advanced. And early on, the symptom is nothing, nada. Okay. And that's when you want to catch it, which is why I'm really stressing getting your screening by the PSA. But by the time it's advanced, you could have problems with your urine flow, where you feel pressure in your bladder, like your bladder is full, you have to use the restroom, but you get there and nothing comes out. It just kind of dribbles out. You can also get that if you have something that's benign, BPH, the benign prostatic hyperplasia, but it could be a sign of cancer. You can get bleeding. And especially if the prostate cancer has kind of eroded through some of the tissues, you can get bleeding in your rectum. You can get bleeding in your urine. You can have an unintentional weight loss. You're losing weight and you're not trying to lose it. You can have that issue. And so these are some of the things that can happen with the advanced prostate cancer. And then, of course, it can spread to your other organs, your other tissues once it becomes stage 4. But again, the stress is to try to catch it early before it spreads. And so if you haven't been screened, and especially if you're over the age of 40, or if you have a family history and a close relative, please go ahead and call your doctor, your internist, your family doctor, your urologist, and ask them for a screening for prostate cancer. Okay.
All right. Thank you.
Thank you for that question. Yeah.
And another question, Ms. Anita Gibson. Does Viagra play a part in developing it?
No, I'm not aware of any evidence that Viagra plays a part in developing the prostate cancer. It's so interesting. I never say never, because we always have such crazy research and things that come out. But I will tell you where Viagra can play a role for a lot of the men who are of the age where they're at higher risk for prostate cancer. Many do, as we talked about, develop some erectile dysfunction. And in that case, Viagra, Cialis, things of that nature really can help men to continue to enjoy their sexual health, to enjoy their partners. And so you will have kind of a hand-in-hand thing where the men who are at risk for prostate cancer will be using the Viagra. One thing that's important. Now, I know we talk about some of these medications that you can get over the counter, and I know for a fact that some people will get Viagra from their doctors and then go sell it out in these streets. Well, let me tell you something. You really don't want to take Viagra unless it's under the supervision of your physician, because if you're taking like a nitric oxide, or like a nitroglycerin tablet, say you've had heart disease and your doctor tells you to put, something on your tongue, and if you feel the heart pain, that could put you at risk of low blood pressure and even death. Or if you take like Emdur, isosorbide, some medications cannot be taken with the Viagra. So if you're someone who's out here in these streets and getting your own Viagra off the streets, like you from the local Viagra dealer, please don't do that. Talk to your doctor, because Viagra can have an issue. Thank you for that question.
All right. You want to touch base on a couple of questions from your previous videos?
Yeah, why not? Why not?
All right. So we have Know It All 280.
I know it all, 280.
Dr. Frita, why don't any doctors recommend drinking cranberry juice for patients with kidney disease? I have had kidney disease for over 10 years and have seen my doctors over the years for it, yet no one has told me to drink cranberry juice. What are your thoughts on the benefits of cranberries and cranberry juice?
Okay. Well, so this is interesting. When you see your doctors, then most doctors are going to strictly talk to you about the best evidence, right? The evidence-based medicine. And so they're going to tell you that they know that diabetes is the number one cause of kidney failure. So have a good blood sugar to maintain kidney health and to prevent kidney disease. They're going to tell you that high blood pressure is the second most common cause of kidney failure. So they'll tell you to make sure you maintain a normal blood pressure. They also know that dehydration can send people into kidney failure. And so they'll tell you to make sure you stay hydrated. And you want to consult with your physician on what hydration is best for you. But for many patients, it's 2 to 3 liters, or if you think about a 16-ounce water bottle, it might be anywhere from 4 to 6 of those. They're also going to tell you that you should avoid certain medications if you already have kidney disease, CKD, chronic kidney disease. For example, certain pain medicines like the NSAIDs, non-steroidal anti-inflammatory drugs, can make kidney disease worse if you already are vulnerable. So I'm talking about things like ibuprofen, Motrin, Celebrex, meloxicam. Again, these aren't bad for everyone, but if you already have kidney disease, talk to your doctor because the NSAIDs can make it worse. There's certain antibiotics that can make your kidneys worse. If you have a large prostate, that can cause blockage and make the kidneys worse. And certainly if you have other congenital diseases. So doctors will talk to you about that. But when it comes to cranberries, here's what's interesting. So you notice when you're eating the cranberries, they have kind of a gritty texture, right? Like they have resin, a grit. Well, here's a theory on cranberries. When you drink cranberry juice, and I'm not talking about the cranberry juice cocktails that are full of sugar. I'm talking about the real natural organic cranberry juice. When you drink the cranberry juice, the theory is that grit, that resin, will help to bind to certain bacteria that will cause urinary tract infections. So like E. coli, some of these sticky bacteria that like to climb up your urinary tract system and cause you all kinds of problems. The theory is that when you're drinking cranberry juice, that will help to bind to those things. Quite honestly, we also know that if you keep a high urine flow, if you're drinking a lot of water, and for the urinary tract infections, I'll tell you this, and I have a YouTube video on this. I'll go into more detail there. But if you're someone who has gotten honeymoon cystitis, which is when females, specifically ladies, tend to get urinary tract infections right after intercourse, the way to help to prevent that is as soon as you're finished with the moment, instead of just sitting there basking in the glow, get up, go to the restroom and urinate. Why? Because if you just sit around after intercourse, for ladies, because females have a short tract between the bladder and the outside world, men have a much longer one between the bladder. It has to travel a longer way in men to get to the outside world. But for women, because we have a short urethra between the bladder and the outside world, it's easy for the bacteria that we all have bacteria on our bodies. It's easy for that bacteria to climb up and to get into the bladder. So to prevent honeymoon cystitis, one of the best things you can do other than being well hydrated is to hop up, go use the restroom, because that urine flow can help knock some of those bacteria out. But yes, theoretically with the cranberries, the resins can also help to bind to the bacteria and put them out. There's not a whole lot of overwhelming evidence on it. Like, in other words, we don't have huge randomized controlled trials on cranberries. Why? Because no pharmaceutical company is going to spend millions of dollars on cranberries, right? They're going to spend millions of dollars on the different drugs where, you know, that actually they can get paid for. So just because we don't have huge randomized controlled trials, it doesn't mean that the cranberries aren't helpful. It just means that the data is limited. But I hope that answers the question. If you're doing the cranberries, then cranberries are healthy in general. But if you're doing the cranberry juice, not the cranberry juice cocktail, and if you make sure you watch, I have a video, The Truth About Kidney Detox, where I actually do go into different fruits and vegetables that can help your kidneys to filter better. I talk about using lemons with their vitamin C and their citrate. I talk about bananas. I talk about celery. I talk about apples. So you want details on fruits and some vegetables that are good for kidney health? Please watch my YouTube video, The Truth About Kidney Detox. My son is in that one, and he helped me to make some of the detox drinks, but he wasn't necessarily all of that keen on drinking the ones that had like spinach and kale, but you'll see it. But thank you for that question. I'm someone who does go into details about what fruits and vegetables are good for kidney health. Who else do we have, Shador? So I know I still have to get to the Princess of Wales.
Yes, you do. Let's see what I want to go with this one. Got some pretty good questions in here.
Okay.
From Nita Perez or Nitsa Perez. I'm sorry. Dr. Frita, why can't they detect HPV on men, but in women they can?
Oh, interesting. Oh, that's a good question. So interestingly, they can detect it. For women, it's more common. So HPV is the human papilloma virus. It is the most common sexually transmitted infection, period. And yes, it is a STI. It's a sexually transmitted infection. But here's the gag. Most people who've had intercourse have been exposed to it. If you found out from your doctor that you have HPV, don't go and start cussing out whoever you were intimate with, because chances are that person probably didn't know, because it often has no symptoms. It's asymptomatic. But here's the thing about HPV. HPV is the most common cause of cervical cancer, which gets us to the women, and this relates to your question. When women get screened for cervical cancer, okay, through pelvic exams and pap smears, and it's recommended that women do it at least by the age of 21, then there's a pap smear that's done where you can swab the cells of the cervix, okay, and you can find out if you have HPV that way. So there are certain strains of HPV that cause cervical cancer, the most common cause of cervical cancer, but then there are also other strains that can cause warts, can cause genital warts. And so if a man, for example, has genital warts, then certainly those warts can be removed and sampled. You can find out if he has HPV, or he could be swabbed for HPV. Is it as easy to find in men as it is in the cervix of a woman? Perhaps not. But men can also get HPV. Men and women can get HPV in other places. You can get HPV in the anus and the rectum, and it's actually a cause of rectal cancer. And so we actually also have anal pap smears, okay? And certainly for anyone who's having intercourse that way, that puts you at a high risk, but both men and women can get it that way. So men, guess what? They can get anal pap smears to find out if they have HPV. So yes, you can find it in both men and both women. It just happens to be more routine that we screen for it in women. Yeah, which also takes me to one of the headlines that we had on Jessica Petway, a beautiful, beautiful young influencer who just died of cervical cancer at the age of 36. She was a wife of 12 years, the mother of 2 daughters, beautiful girl. If you go to her Instagram, Jessica Petway, you can see more about her. Let's see. What do we have here? Do we have a video or just the headline?
Just the headline. Yeah, I'll scroll through. You talk.
And also, if you go to my Instagram at dr.frita, follow me there. I did a video where I go into the details of how to be screened for cervical cancer, okay? And I talk about the things that you should do, and I go into HPV. And I talk about the best way to prevent cervical cancer. You know what that is? Getting an HPV vaccine. Here's the thing about Miss Petway, Jessica Petway. She actually did seek medical attention. She shared, before she passed, of course, that back in June 2022, she was told that she had fibroids. And from June 2022 all the way, from June 2022 or June 2023 all the way through January, she was told that it was fibroids. She was told that it was fibroids. And then finally, when someone biopsied her in that February, finally, she was told that she actually had stage 3 cervical cancer. I think it was June 2022 through January 2023, where she had a misdiagnosis. But if you go to her Instagram, you'll see for sure. And then if you go to my Instagram at dr.frita, I'll give you a nice little, some information for you to use to screen yourself. But it's just very frustrating that she's someone who had symptoms. She had heavy bleeding, and apparently her voice was not heard because someone could have done a biopsy of her cervix a long time ago. I don't know the details, but this is something she shared out of her own mouth. And so I'm really so sorry that she was misdiagnosed and that we lost this beautiful young lady. So if for anyone who's listening, please talk to the women in your lives, anyone who was born a woman by no later than the age of 21. They need to be screened. It's recommended that they're screened for cervical cancer. And if you're dealing with a teenager who's sexually active, that conversation needs to be had as well about when to screen, because you might want to get screened earlier than 21. And again, the HPV vaccine is available. they start offering it to children as early as the age of 9, between 9 and 11. Originally, you know, it said you can get it up to like the age of 26. If you're going to get the HPV vaccine, you want to get it before you've actually been exposed to HPV. But now up to age 45 and beyond, you can get the HPV vaccine. Just have the discussion with your doctor about it. And full disclosure, all 3 of my kids have been vaccinated against HPV. So the chances of them getting cervical cancer from this very, very, very common disease are very, very low. So yeah, the HPV vaccine, talk to your doctors and check it out. Okay.
Thank you, Dr. Frita.
Oh my goodness.
Story at hand. You want to go over it?
What's that?
Princess Kate?
Let's get into Princess Kate. Oh, there's so many other things I want to talk. There's so much medicine in the headlines, but I will talk about Princess Kate. One thing I will tell you all, please be on the lookout on all of my social media platforms. The world's first pig kidney was transplanted into a living human. Yes, I said it. It was a pig kidney transplanted into a human. They genetically modified the pig to help so that the human doesn't reject the pig. But it's a 62-year-old Black man who had been on dialysis for years. He'd had a transplant before from a human, but after 5 years, it rejected. Now he has a transplant from a pig. Now, this may sound a little off-putting, a little sci-fi to some folks, but I am a kidney doctor, and let me tell you, I've watched many of my patients die while waiting for transplants, okay? According to the United Network of Organ Sharing, it depends on the year, but over 90,000, sometimes 100,000 people are waiting for transplants, and 17 people die each day while waiting for a transplant. And there's disparities, health disparities, especially racial disparities, where a lot of Black people, Latino people, certainly people of low incomes, a lot of them aren't getting the transplants. They don't have the money. With these genetically modified pigs, it's possible that we can increase amount of organs because there are a lot more people waiting for organs than organs available. But I was on a national news show this weekend on Scripps News, and so I will be posting that. So stay tuned for me to post that this week, where I was on there talking about the pig transplant. And March is Kidney Disease Awareness Month. Want to throw that out there. So let's just talk real quickly about Princess Kate, the Princess of Wales. We know that she went in for an abdominal surgery, right? And then she kind of disappeared. And so you had a lot of people who were speculating, trying to see what happened to her. And you had all kinds of conspiracy theories and things that really were a little silly, a little foolish. But what happened was on, I believe, the UK Mother's Day, she posted a photo and they found out that it was photoshopped. It wasn't really her. And so people started really wondering, like, what happened to her? So just this past week on Friday, the Princess of Wales, Kate Middleton, shared that she's been diagnosed with cancer. She said she had an abdominal surgery, and then they realized that she actually had cancer. And so what I wanted to do was touch Shador on some of the possibilities of what she could have, not to be nosy, not to be in her business, but really so that anyone who's listening can understand the age-appropriate cancer screenings. Okay. And if you have loved ones who have not been screened for cancers or loved ones who are having certain symptoms, you can encourage them to go and to get help. You know, I'm certainly praying. We're praying, you know, that Princess Kate does well. You know, she's a mother of those 3. Those kids are really cute. And I don't know how they sit still during some of those royal ceremonies. They don't always, but she has those 3 kids. She has her husband, who is next in line to be king, Prince William. And, you know, she's just a young lady, a 42-year-old lady, a mother, a wife, a person, a human. You know, she's a public servant. She does a lot of public service. And so we're praying that she does better. And so let's talk about some of the possibilities. So one of the possibilities in a young lady is ovarian cancer. We don't have a routine screening, Shador, for ovarian cancer, but it can present as a mass. You know, if it presents as a mass or as a cyst, it's something that could be benign, but it could potentially be cancer. So ovarian cancer is something that is one of the abdominal cancers. Certainly pay attention to your bodies. If you have any irregular periods, if you have any pelvic pain, women, go get checked out. You can get an ovarian ultrasound to see if a mass is there, and then further investigation can be done from there. And then uterine cancer, you know, or endometrial cancer is something else that could happen. Again, we don't have routine screening for the uterine cancer. But certainly if you're having pelvic pain, abnormal bleeding for the ladies, then you want to make sure that you go get checked out. There are things that can be done like endometrial biopsies, so biopsies of the lining of the uterus. But again, we don't have routine screening. You want to pay attention to your body and understand that sometimes doing imaging like ultrasounds is something that can pick that up. So that's another potential abdominal cancer. Cervical cancer, which you've talked about, we do have routine recommended screening for that. Pelvic exam, pap smear, no later than the age of 21. Consult with your physician. What I give on this channel is it's information. It's not medical advice. You want to get that from your personal physician. But we do have screenings for that, and you want to make sure that you advocate for yourself. If you're still having symptoms, if you know your body's not quite right, then even if you don't get the answer from the first physician, go to the next. Ask for a biopsy, ask for a colposcopy, these things. Make sure you advocate for yourself, because like with Jessica Petway, that beautiful influencer who just passed away, she did go to hospital. She did seek medical care, but was still misdiagnosed. So just, that one's a sad one. Some other things in the abdomen, or of course we have the stomach. People can get gastric cancer, and that could present in different ways. Like if you are getting, having a vomiting up of blood, if you're having an early satiety, meaning you eat, but you get full really, really quickly, that could be a mass in the stomach. And if you see your doctor and get a referral to a gastrointestinal doctor, a GI specialist, they can do endoscopies where they go down and they look, and certainly CAT scans or imaging can help. Other things in the abdomen, small intestines, those can get cancer as well, rarely. Colon cancer, colorectal cancer. We have screening. We used to say not to get a colonoscopy until you were 50. Now the age is going down. That's another one of those cancers that tends to affect Black people at earlier ages and more aggressively. We know our Black Panther, Chadwick Boseman, remember? He died of colon cancer, and he was young. He was actually younger than the age of routine screening. He was younger than 45, definitely younger than 50. But the colon cancer can present with unintentional weight loss, bloody diarrhea, things of that nature. Kate Middleton, Princess Kate, is only 42. So she would have been too young to get routine colon cancer screening. But if you have a first degree family member, a father, a mother, a brother, a sister, or, someone who has colon cancer, then it's recommended that you get cancer screening. And it depends, talk to your physician, but generally at least 10 years before that person. So say you had someone who was diagnosed with colon cancer at the age of 48, then who's a first degree relative, then no later than age 38, you should be it's recommended that you get your colon cancer screening. Talk to your doctor, okay, about what's best for you. But that's just another one of the possibilities. So if you haven't had your colon cancer screening and it's appropriate for you to make sure you get that screening. There's all kinds of other things in the abdomen. There's a pancreas, certainly you can have pancreatic cancer. Remember Patrick Swayze from Dirty Dancing? He had pancreatic cancer. Aretha Franklin, the Queen of Soul, had pancreatic cancer. Again, no routine screening, but depending on where the cancer is, if it's at a place where it blocks some of the bile flow, you can get jaundice, meaning like yellow in the whites of your eyes, yellow skin, unintentional weight loss. You can even get pale stools if it's in a certain place in the pancreas. Imaging can help to find it, but yeah, pancreatic cancer is another one. Lymphomas, sarcomas, liver cancer. If you have hepatitis, you could be at higher risk, like hepatitis B, hepatitis C. If you are a heavy alcohol user, that could put you at high risk for liver cancer. There's all kinds of cancers, bladder cancers, kidney. That's more retroperitoneal, meaning it's more in the back space. But certainly if you have like a stage 3, if the kidney cancer was spreading, you could get that. That can present as blood in the urine. Cigarette smoking puts you at risk for kidney cancer, among some other cancers. But the point is, I want everyone listening to make sure that even though we don't have routine screenings for all of those cancers, make sure at very least you do get the age appropriate cancer screenings for those abdominal cancers that we do have recommendations for. And if you again go to my IG at dr.frita, follow me there. That's my most recent post where I go through the differential diagnosis of the possibilities of cancer in the abdomen. Of course, we are praying for the Princess of Wales, Kate Middleton. Let's see. I think that's about all we have time to talk about, Shadora. Time flies when you're having fun. I don't know about you. I'll be having a good old time talking about medicine in the news. Do we want to close out with any more comments or any kind of one you think is a burning comment? Yes. We should. Oh, what you got? What you got?
Rosalie Punts, she's back. She said, I just
Hi,
took
I'm Rosalie.
the colorectal screening. I'm assuming. Is that a good test? It was normal. I think when you get the home colorectal screening, maybe.
Oh, so this is definitely a conversation that you should have with your primary care physician and specifically your gastrointestinal doctor, because it's going to depend on your risks. If you are someone who has had polyps, which are like little benign growths in the colon, okay, but they could be precancerous. If you've had polyps, then your doctor may recommend that instead of just doing that home screening, that you're someone who should get the colonoscopy where they can actually see. But if you're at very low risk, you don't have a family history, no history of polyps, then those home tests can pick up certain parts of the DNA that can let you know whether or not you're at risk for colon cancer. So that's going to be a conversation for you to have with your physician on what is right for you, depending on your risk level. That's a good question.
And Ms. Zanray, 27.
Hi.
Vitamin D deficiency increases one's risk for cancer.
That is a very interesting question. We have so much research. So we know that vitamin D is more than just a vitamin, right? We used to think that vitamin D, okay, it's a great vitamin. It helps you to absorb calcium, to have strong bones. But now there's so much research that's going on with the vitamin D, where we know that it's something that can promote good immune health, right? During the lockdown with the worst virus that caused the whole world to shut down, we found that people who got very sick with that virus, the C virus, tended to have low vitamin D. And we also know that people who don't get a lot of sun exposure can be at high risk, and people with a lot of melanin. Okay, if you have dark skin, even if you do go out in the sun like me, then that sun, the UV light, which normally is converted into vitamin D in your body, it won't necessarily be converted. So that's why it's important to know your vitamin D level and to get vitamin D supplementation, or to eat foods that are high in vitamin D if you don't have it. So with that, I will say vitamin D is good for a whole lot of things, but we don't have any absolute definitive evidence that I'm aware of that there are any specific cancers that your risk is increased for. But I will say this, knowing that vitamin D is directly related to the immune system, and we also know that the immune system can play a role in cancers, then what you want to do is make sure you have a replete vitamin D level, and that will be good for your overall health. Good question.
Yeah, good question. Thank you. All right, Dr. Frita.
All right. Oh, I don't want to go. But guess what? The good news is that we'll be right back on next Monday with another medicine in the news, where we'll hit again on some of these health topics. Make sure that as you watch this video that you like it, you subscribe to my channel. And for those of you who didn't get a chance to ask a question, if you want to talk to me one-on-one, you want some one-on-one attention, I do have a concierge telehealth medical service where you can book an appointment with me. I'll make sure I put the link in the description, and we can talk about your health. Yes, we can talk about kidneys, but we can also talk about obesity. We can also talk about pediatric medicine. We can also, if you just want someone to run something by for a second opinion, we can do that. Or if you just have something personal and you just really don't want to put it out there like that, or if it's going to take time, you can book a one-on-one appointment with me where I will give you quality information about your medical issue. That's my concierge telehealth service. Okay. All right. Well, I thank you all for joining, and I look forward to seeing you on next Monday for our Medical Monday and our next Medicine in the News with Dr. Frita. Shador, thank you so much to my co-host.
You're
And
welcome.
Shador, I'll see you in the office when we see our patients. we go back to the day job. All right. Thank you, everyone. I'll see y'all next week.